I don't want to put Linda in the dark, but I might put a little bit in the dark. There we go. That gives a little more contrast, right? Skin integrity and wound healing. It's quite intense. So we're going to start off with a story. Don't y'all love stories?
Oh, got it, bud.
Yes, I've aged Mr. Moore. He's 78-year-old. I'm dead. I'm already past. I've done past.
That's already a sad story.
Is it? It looks sad up there, doesn't it?
Yeah.
He fell 3 days ago. It resulted in a fractured hip, and he was found again by the mailman. Those mailmen, they probably get training in emergency health procedures. I bet they do as part of their orientation. Wow, that's a nice phone ring, though. It's like a real phone.
Haven't heard that in years.
Yeah, I don't have that. You have to pay special money to get that. Aside from having to have hip surgery, he developed a decubitus ulcer as a result of laying on that floor for 3 days. So upon arrival to the hospital, Mr. Moore was unresponsive because he had laid there for 3 days. He's 78 years old. Most likely as a widower, he's started to stay within his shell, and he's frail, and he's not probably been in the best health, and nutrition-wise, he's probably not maintained such great nutrition. I mean, you can envision that, right? He looks sort of thin anyway.
Is that his
Yeah, it is.
butt, back?
You're looking at the back end. Yeah. Okay, so he was unresponsive, extremely dehydrated, and close to death. He has the following, which that does allude to him having serious problems anyway. He's had a history of myocardial infarction 3 years ago. He's had recurrent bouts of congestive heart failure because he had a left-sided infarct on his heart. So sometimes he goes into these things called pulmonary edema. He's had some bouts. That's where the lungs fill up because he's either had too much country ham, or he took too much fluid in, or he's not taking his medicines right, he's not following his daily weights, et cetera, et cetera. He's depressed because he's lost Miss Moore 3 years ago. So he had a heart attack 3 years ago. See, and it's because I died. That's what happened to him. He no longer wanted to survive.
That's hypothetically getting worse.
It's getting sad, right? It's sad for Mr. Moore. He was, last year he was hospitalized for pneumonia. He's never had a decubitus ulcer. So that's
His first one?
yes, it's a doozy. Doozy. 3 days on the hard floor. 3 days. So let's start off. We're going to remember our scenario.
That's overnight.
We'll start off with a little A&P, and y'all had all this old history about the layers of the skin, right? Y'all recall this, don't you, vaguely? You had A&P, you had to have A&P before you got into this course. So we know the layers, the different layers, and I gave you a little illustration of it, epidermis, dermis, subcutaneous. Now, in your textbook, talk about specifically, let's talk about the epidermis. That's the outer portion. It's got 4 or 5 layers. This stratum corneum, it's the outermost layer. It's those dead cells. But those dead cells provide a protective barrier. It's very important. Those 4 or 5 layers. You have this stratum germinativa. I'm butchering these words. Good thing I wasn't an A&P instructor, right? Centermost layer, the epidermis, is continuously producing new cells to push those older cells out, see? Sort of like a cycle, you know. Then you have these other layers of the epidermis, keratocytes. Those are the protein containing cells, melanocytes, melon, right, pigment color, and Langerhans cells. And Langerhans, that would be referencing those cells that would eat the foreign matters or materials. You know, sort of like helps with the immune system. Then we have what they call the dermis, and that lies below the epidermis, but above the subcutaneous tissue. Blood vessels are abundant in the dermis. They also have these other little items within it, the sweat glands, sebaceous glands, the, I don't know how to pronounce that, seremus glands, hair and nail follicles, sensory receptors, and that elastin collagen. Now you can imagine if you went back to Mr. Moore's, that first slide, he's just been totally obliviated in some of those, in that area where the cubitus is. Then you have the subcutaneous layer, and that's composed primarily of connective and adipose tissue. Sub-Q injection sites. I wanted to illustrate sub-Q injection sites. Now notice, I've never given a sub-Q injection back here. This is the back side, guys, not the front side. Back side. You know, not going to give shot in the heart. Right, that's the back. But I've never given one back on the back side. You know, but I guess you could. You know, typically you see diabetics. You know, they're administering their own insulin. They give in their stomach because it's you know, for ease, or they might do their thighs. Yeah, you know, the upper arm region. It's not really deltoid. When I say deltoid, that's muscular, right? Deltoid. So it's not really deltoid. Right or left arm for subcutaneous. IM, that would be left deltoid, right deltoid. If you're going straight in 90 degrees. Subcutaneous is what? 45 degrees, right? We lucked out. Our group got to give flu vaccines. They can say they've done it. Every one of you's got to do one. And you got to see the process. Oh, and see, I just took the time to even point these injection mechanisms out. But, and then it's a nice touch because you may be doing this tomorrow, some of you. Might have to give some injections at that medication cart site, right? See how that comes in handy. Just a refresher reminder, right? Intramuscular is IM. There's some particular sites for IM injections. I would tell you that I strongly believe that you'll see this on state boards a lot, this vascus lateralis. I think that's tied a lot for peds, pediatric patients. They'll ask that. What's the recommended site? Yes?
ATI said no more dorsogluteal because they think it leads to sciatica. Or there's
Well, let me
Oh,
tell
yeah,
you
for the
what's
kids.
the deal here. Because the sciatic nerve travels on this panel. And what we find is nurses have developed poor techniques. So I don't know if ATI, you know, I understand what they say recommend, but you will still see that out there and still do it. Here's the thing, guys. You never go wrong if you, my technique is, and I'll go to the back, put your hand on the patient's center hip wise, where that thumb is, upper, outer, quadrant. You can't go wrong. You can imagine me, say, putting my hand on this patient's hip, and my thumb would go. See what was happening is nurses were just not even paying attention. They had poor technique and they would be injecting in this region. That's where that nerve travels. upper outer quadrant. Upper outer. And of course, IM injections, you'll have this on state board, and I didn't put that in there, I don't think. That Z-track is preferred method, and actually, they say it's the least painful. That's what they say. So remember, Z-track, as you're preparing for boards, understand and know your injection sites. Understand and know your angles, your degree angles of your injections. And don't forget to review that Z-track method, right? Okay. Age-related variations. Well, skin of an infant and young is very smooth. They've not been exposed to the elements yet. But as we get older, it's just like I still have, my car is now 10 years old and it has some hiccups. It's with anything, it starts aging, we start having few issues. Things stop working the way they did when you bought the vehicle new, when the person is brand spanking new, the infant. So as adults age, we have diminished glandular function, results in drier skin. I forget how you say that. Exrosius? Forget. I'd have to listen to the audio, but this is a condition that relates to itchy, red, dry, scaly, cracked skin. 85% older adults can have this kind of condition. I will tell you that you may most likely see that item on state board, because why our patient population is getting heavy and heavier toward the geriatric population. It's the fastest growing population. You are the guys that's going to take care of us old people. And when I say old, as I was doing simulation this weekend, because I made them do simulation too, and I would have to come in every now and then acting as a house officer or whatever, and realized I'm getting very old. I have this gray hair. My husband says, well, that's because your son's caused you to get gray. And I said, well, maybe, but I think I'm just getting older. We'll take a break after this slide. Impaired mobility, nutrition and hydration. You remember, go back to 78-year-old Mr. Moore. He has all of these problems. Poor nutrition, poor hydration. Elderly, it's a fact. They typically don't get in enough hydration. That's why they have these situations where patients in nursing homes sometimes might come in, get admitted 2 a.m. in the morning, and they have come into the ER unresponsive, no blood pressure. You insert a Foley catheter and you get CERT back. And really what's happened is failure on our part to make sure that they're well hydrated. You know, each and every one of you has got a cup here. I got a cup, got a bottle. We are freely able to get our when we're thirsty, we get something. You'll typically see the nursing home patients, they get something to drink at meals. They have ability to have a cup there at their table, their bedside table, but do you really see, I mean, all of us, see, we're walking around with cups and bottles, but do you really see that going on in a nursing home? Wouldn't that be an interesting concept to actually spin off on? Is develop a mechanism whereby all residents would have a bottle, some way or another, that besides, yes, but it'd be right there, at ease for them to be able to get water at any time. Wouldn't that be a novel thing? Let's invent it, and then we don't have to even work as nurses, right? So we'll take a break. Oh, one thing I want to show you is about how to detect the turgor. When you have decreased skin turgor, you'll have what they call tinting. That symbolizes tinting. You see it stayed. It's not elastic. That signifies they're dehydrated. They don't have enough. They're not taking in enough fluid. Tinting. That's a way to test hydration. Okay, so take a 10-minute break. Everybody be back in your seat at 9:05.